Homelessness has many faces. It's the mother and child who have fled from domestic abuse into temporary shelter and now have no place to go. It's the aging veteran who has never really gotten back on track since his discharge. It's the family who spent their last few dollars coming to town on the promise of a job that no longer exists. It's the woman whose illness caused her to lose everything, including her home. It's the man who, like so many others, is a victim of economic downturn. It's those who grew up in foster care and have never had homes. Homelessness has many faces, all of them tragic, all of them beautiful. But we're not here to romanticize homelessness. We're here to end it.
Homelessness is a really complex issue. There's not one reason that people are homeless. There's many reasons.
Homelessness is obviously a national issue. I mean, in any major American city, you're going to see this. You're going to see homelessness. But what it does to a city is, it does. If you don't try to get to the root of the problem and try to solve the problem of homelessness, you end up just giving Band-Aids, putting Band-Aids on the problem, and the Band-Aids are expensive.
You know, when you compare what it costs in the criminal system and in the judicial system to adjudicate somebody that's had, you know, vagrancy or a charge of public drunkenness, you know, it's $1,000 a day. If you look at what it costs annually for us to provide wraparound services for an individual, and it's $17,000 for a year, that number starts to look a little less expensive and a little less daunting. We all know that emergency room care is far more expensive than providing primary care through community-based clinics on the front end.
There is a lack of affordable housing in Nashville. It's interesting, Section 8 housing is for the poorest of the poor, right? But the thing about Section 8 housing is it's completely inaccessible right now. There's a 2.5 to 3 year waiting list for Section 8 housing. We applied people for Section 8 housing in December. It's July, and we just got notices in the mail saying, congratulations, you guys are on the waiting list. You're number 2,631.
Nashville, from my perspective, has a pretty good support system. What it lacks is what some other cities have, and that is just inventory of housing. Even if they have a source of income, it's a difficult process because of credit applications, because of criminal issues, all of which are valid, but still don't negate the fact that a person needs a place to lay their head at night.
People ask us if we have all the housing we need. Well, the answer to that is no. Over the next 5 years, our goal is to produce over 1,600 units of housing so that we can take families off the street, children off the streets, individuals off the street, and put them directly into housing through our Housing First concept.
We have a significant lack of affordable housing below that, you know, $400 or $500 a month amount. So it is very difficult for somebody who's currently sleeping in their car or sleeping on a couch or in a tent city or on the street to make that transition.
Housing First is a no harm, no foul initiative that allows us to take homeless individuals right off the street, right out from under the bridge, and put them into housing right away with wraparound services.
To be able to get someone into housing is probably one of the greatest rewards of things that I've done.
The Housing First model is, I think, kind of about human rights. It's saying people have a right to shelter. So before we ask them to work on anything else that they can't work on right now because of their state of instability, we're going to put a roof over their heads and settle that and agree on that as a community, and then work on the rest of the stuff. It's a really effective model, and it also is very cost efficient. Instead of putting people in jail, instead of putting people in the hospital, we're putting people in housing.
Ekman Freeman provides all the wraparound services for the Housing First model, which is a different model than people are mostly accustomed to. It's coming and meeting a client exactly where they are and getting them in housing before addressing any other issues.
Once people go into Housing First, we're able to develop a better individual program plan for that individual. We have found that their health improves because they're not exposed to the elements, and so now we're able to coordinate through the wraparound services a health plan for that individual, or a transportation plan, or a dental plan for that individual, whatever is needed to help that person improve their quality of life.
Serving the homeless not only requires trying to communicate a sense of dignity and encouraging people to think of themselves as clients, and the fact that they're not able to pay at that time doesn't change the sense of rapport between the service provider and the recipient.
The first key was finding him a safe place to stay and finding him an apartment. Then we worked on Social Security, getting that in place so he had some stable income. Tony's a success because we were able to give him all the different pieces of the puzzle, and he was able to put it together and successfully complete our program. That's where he's at now. He doesn't need us anymore.
As a government, we can't solve the homelessness issue by ourselves. We need to get the entire community rallied around the issue.
I had a teacher once at David Lipscomb that used the phrase, the king's business requires haste. I'm a little emotional about that. In effect, helping the homeless is the king's business.
I think we've seen in Nashville, and we're seeing across the country right now, that the issue of homelessness, the problems that it creates in communities, can be solved. And that with a great deal of involvement from individuals, from corporations, from faith-based communities, from government, and from nonprofit agencies, if we truly do work together and leverage these resources in the right way, we can end homelessness in Nashville.